Hello, Parenting Genie community. Wednesday night, I think it's the 24th or 23rd. It should, oh no, it's only the 22nd of April. So, hello, everybody. It's Constance here, your lactation consultant, presenting for Parenting Genie again. I'll wait a few more minutes because I got in a little bit early tonight. So if there's anybody watching it live, hello to you, wherever you are in this world. I suppose most of you may be watching this from Australia, but who knows? And it's just a glorious day at the moment. I mean, it's glorious days. We're in the middle of autumn, but it's just so warm that we have to start watering again because we also did not have that much rain. So I'm in Melbourne in Australia, and I will be starting in a few minutes. So tonight I am going to keep it fairly short because I've got some other things that I need to attend to tonight. So in fact, it's an art show that I have to go to. It's an opening of an art show and my husband is involved in it. So not as an artist, but as a volunteer. So I have to be there. So you may have already seen the topic that I'm going to be covering today. Now, have you as a breastfeeding woman, breastfeeding mother, breastfeeding person, have had to undergo any medical imaging, such like as an X-ray or an ultrasound scan or an MRI, CT scan, mammography, which is an X-ray? What were you told? That's the question. And that's why I called this topic pump and dump. Really? That is not up-to-date information at all. And so if you would be told to interrupt breastfeeding, that would have to be a very, very good reason. So tonight, I am going to walk you through some of the procedures that may need interruption of breastfeeding, but the majority of medical imaging or X-rays, as we call them, do not need that. So it may not also be an interruption, it may be a delay of breastfeeding. That's possible as well. So I've got a bit of a cheat sheet here. So the fact of the matter is that many health professionals are unfortunately not giving out evidence-based information on that topic. And so what I did is I screened the latest recommendations from the Royal Australian and New Zealand College of Radiologists and also the Australian Breastfeeding Association, as they have really good information as well. But the pump and dump rule is one of the most common pieces of misinformation in a new parent's life, if that's what you've heard. And so the vast majority of diagnostic imaging in Australia is not, there's no need to interrupt breastfeeding. So that's the good news. So let's go first through routine imaging. So that means routine imaging is such as an X-ray. There are standard tests. There's zero risks to the milk or the baby. The imaging energy that is used is either sound waves or magnets or X-rays. And it passes through the body, but it does not remain in the milk. So X-rays and CT scans, they are radiation, but that does not make the milk radioactive. So even though we call it radiation, there is no radioactivity there. An ultrasound uses sound waves, which is completely safe, and there needs to be no interruption of breastfeeding. An MRI without contrast also uses magnets, and it's completely safe. So there's no need to interrupt breastfeeding. Now, if you are a breastfeeding woman and you need a mammography, an X-ray of the breasts, obviously, that is safe, though the breasts may be firmer due to the milk in the breasts. And so it's recommended that you, prior to the X-ray or the mammography, breastfeed your baby to, not empty, but drain your breast, because we know breasts are never empty. Or if that's not an option, then express, so that you get a clearer imaging. The second lot of imaging is with contrast, and that's dyes that are being used. Contrast agents that are used for CD could be iodine, and another one is called gadolinium, and that's used for MRIs. And that's to highlight blood vessels. So if you've had some issues with cardiac situation, heart problems or anything like that, happens even to young women and young people, whether you're breastfeeding or not, then that is done with dyes. So a CT contrast is an iodinated imaging. And the good news is that less than 0.01% of the dose enters the breast milk. And the baby absorbs less than 1% of that tiny amount from their gut. So again, there is no need to interrupt breastfeeding. An MRI contrast with what I've just mentioned, gadolinium, there is less than 0.04% entering the breast milk. Again, no need to interrupt breastfeeding. So the verdict is from the leading bodies, which is the Royal Australian College and New Zealand College of Radiologists. And that's basically, they state that breastfeeding can continue without interruption. And that's all you need to remember. So the interesting thing, though, is that on the contrast, on the dyes, the packet says something completely different. So manufacturers often include a 24-hour pump and dump warning to protect themselves legally, not because it is medically necessary. So that's another message for you tonight. And then I come to the third part of medical imaging, and that's done in nuclear medicine. And those scans are called PET scans. And what they use is radioactive isotopes. So this is the only category where pumping and dumping might be required. These tests involve injecting a radioactive tracer that stays in the body for a short period. Now, the interesting message here is that with the PET scan, there's generally no interruption required for the milk itself. However, it's the physical contact with your baby, the snuggling and the cuddling, that has to be interrupted for up to 4 hours. And that's with a certain nuclear isotope. There is a couple of other scans that are done in nuclear medicine. One is called a VQ scan. When I used to work as a lactation consultant in a large tertiary hospital, I came across a few women who needed these kind of scans, and one of them was a VQ scan, which is to check for clots in the lungs. That is a scan where interruption is required, and it's recommended for 12 hours. Bone scans, generally no interruption required. And then there is one other important scan, and that can apply to younger women and mothers who are breastfeeding. Not frequently, but certainly, again, something that I have come across on various occasions. And that's a thyroid scan. With this thyroid scan, it actually means that breastfeeding has to stop completely. And it has to be stopped 4 weeks prior, roughly, before they're actually doing these scans. But that's just one of the situations where that's done in that way. So important to know is because every radioactive isotope has a different half-life. So you must tell the nuclear medicine department that you are breastfeeding before you get injected anything. And then they will give you a specific time frame, and that's based on the exact tracer or contrast used. So to make all this a little bit simpler, first, is it just a picture? So when we do an X-ray, we get a picture of our breast, we get a picture of our stomach, get a picture of we've got a broken arm, get a picture of the arm. Keep feeding. There's no reason to even question anything. All good. If you need an ultrasound, again, often it could be that the mother or you as a mother get recommended an ultrasound because of maybe mastitis or an infection in the breast. There's no reason to interrupt breastfeeding. In fact, breastfeeding is medicine for mastitis, so it has to keep going. And if it's an MRI, that's again something that is a picture. We're taking a picture, and so keep feeding. Then if it is a dye, like a contrast for a CT or for an MRI, again, you can keep feeding. Third, is it nuclear medicine? The main situation is, or the main message, I should say, is ask for the specific half-life. And then the specialist can give you the interruption window for that specific tracer that is being injected. So last but least, pumping and dumping is not a neutral act. It is hard work. Nobody should recommend that unless they actually know how to even do it. Because what often happens with pumping and dumping, pumping milk and then discarding it, there's a risk that maybe the baby doesn't even take a bottle, and then nobody knows how to feed the baby. If the baby has never had a bottle, how do we give the breast milk? There's also the risk that if the baby does take the bottle, maybe the baby does not go back to the breast. So these are all questions we need to ask ourselves as healthcare professionals before we suggest these sort of things. And then, unless it is specific nuclear medicine scan, the risk of stopping breastfeeding for 24 hours usually outweighs the microscopic risk of the imaging agent. So what that means is that it's better for you to continue feeding than sometimes having that risk of the imaging agent. So again, unless it is a specific nuclear medicine scan, the risk of stopping breastfeeding for 24 hours usually outweighs the microscopic risk of the imaging agent. So that is in one of the protocols of the College of Radiologists, and So that's good. And you can look up the Australian Breastfeeding Association if you have any things that you want to print off or so. There's some, good, you don't know unless I tell you, but there's good information on there. And that's about it, really. Now remember, parentinggenie.com.au is a platform for anything parenting from 0 to 5 years. You can take out a free membership for 2 weeks if you feel like it and you want to suss out what we are up to here, our team. So we do have the opportunity to give you personalized recommendations. We can support you in your parenting journey. Have a look at that. And other than that, I'll see you again in a week's time with either a breastfeeding topic, or we may change again to a baby wearing topic. For now, all the very best. Keep safe and enjoy your pregnancy or your parenthood wherever you are in your life. Okay, bye for now.